What if I told you that heart disease was the #1 killer of all Americans, especially in the Black community? Every time you eat a piece of fried chicken or fried foods, you increase your risk of having heart disease. Yep, that's on Monday, Tuesday, Thanksgiving, Christmas, whenever you eat fried foods. Think about what it could be doing to your heart over time. But if you stay to the end of this video, I'll give you 5 ways that you can incorporate healthy living into your lifestyle. That way you don't have to suffer from cardiovascular disease. Hi, my name is Dr. Eddie Hackler III, and I'm a board certified cardiologist. I've been doing social media medical influencing for a few years now, and I've become very passionate about teaching people healthy way of living and also incorporating things into their life and watching personal transformations along the way. I started off wanting to make videos to get people more access to quality, healthy information. Unfortunately, in our society, some people don't have access to healthcare as other people do. So what do we all have access to? The internet. You have the internet on your phone, your iPad, you can go to the library and get on a computer and have the internet. You can walk outside and get on public Wi-Fi and have the internet. So everybody has the internet. So what's a better way of disseminating information than using that tool? Which is why I started making these videos. Since I was a young boy, I wanted to be a doctor, and I haven't wanted to do anything else, and I haven't done anything else. Over the last 14 years that it took for me to get to this point, I've seen patients who have hypertension, who have high cholesterol, who have diabetes, and of course, who have heart disease. From mild cases to severe cases to everything in between. And the most rewarding part of this is watching people that I actually care about go from doing not well to doing better and overcoming whatever obstacles or ailments that they have in order to get to a healthy living. And to be honest, although I'm a cardiologist, I have to admit that I have not always had the most healthy habits. It was actually a patient of mine that I had when I was an intern, my first year being a doctor, who gave me some great advice that has stuck with me to this day. It was 4 a.m. I had just got to the hospital. I was rounding on all my patients, meaning I was seeing all the patients who were assigned to me and under my care. And I was seeing an elderly gentleman in the ICU, and he asked me, "Hey, can I give you some advice?" Now, this is my first year as a doctor. I'm an intern, I'm learning so much. Of course, I want to hear any type of advice that anybody can give me about anything, even life. He said, "When I was your age, I wish I would have started taking better care of myself then." In his 20s, he said he was smoking, he was drinking, and he was doing illicit drugs, all while eating whatever he wanted to eat. And he felt like the choices that he made at that young age were now the consequences that he was dealing with in his 60s and 70s. And that stuck with me wholeheartedly because in our 20s and in our 30s and our 40s, we think we're invincible. We think our bodies can just take whatever and bounce back. But we don't realize that the things that we're doing to our bodies at these young ages are exactly what we're gonna have to deal with when our health starts to fade and we turn 60 and 70. So you made it this far in the video. Let's jump into those 5 healthy lifestyle tips. Number 1, exercise. Exercising is so important for your cardiovascular health. The American Heart Association recommends just 30 minutes a day, 5 times a week of at least moderate intensity activity. What is moderate intensity activity? Brisk walking can be considered moderate intensity activity. And walking is such a great tool to increase our cardiovascular health. Studies show that as little as 2,000 steps a day, upward to 7,000 steps a day can drastically decrease your cardiovascular risk. Different ways that we could possibly get to at least 2,000 steps a day, which may seem like a lot, but really isn't, is if there's a grocery store close to your home, can you walk there instead of driving? And if it's not close enough to drive, when you get to the parking lot, can you park further away from the door, which increases your walking to the door and backward? At work, can we take 30 minutes out of our lunch break in order to just walk a few laps around the building? Or if we have elevators, can we take the stairs instead? There are so many things that we can do to increase the amount that we walk to get to that minimum of 2,500 but also even closer to 7,000, which would drastically decrease your risk of cardiovascular disease. We can definitely do that. Number 2, sleeping. Hey, look, I know some of you are probably tired now, but stay with me, we're almost there. People need about 7 to 9 hours of sleep that is adequate for staying healthy. And getting these 7 to 9 hours can decrease your risk of cardiovascular disease by about 20%. Short sleepers and long sleepers, people more than 9 or people less than 7, that's where that risk comes in, and we don't want to be there. And an added benefit of sleeping is that people's blood pressure typically lowers while they're sleeping. So people who get adequate sleep typically have better blood pressure control, which we all know is one of the main risk factors for cardiovascular disease. Number 3, we're back to diet. Your diet is so important for your cardiovascular health that we need to spend some time here. So one thing I definitely would recommend is limiting salt intake. Wherever salt goes, fluid tends to go and your blood pressure increases. Things that you can do to limit salt are by not adding extra salt onto your food already. Also, watching the labels when you buy your foods to make sure that the sodium content is not too high. We like to stay around 2,300 milligrams of sodium per day. And if we stay in that sweet spot, our blood pressure typically will thank us. Additionally, we want to decrease saturated fats or trans-saturated fats. So these come from fatty meats, full fat dairy products as well. Also, we want to increase our fruits and vegetables. We also want to increase whole foods, whole grains, things of that nature. Decrease processed sugars and processed foods in general. We also want to limit carbonated drinks and very sugary drinks. Different ways of doing this is cooking your own meals and preparing your own meals. Who doesn't like to go out and try new restaurants, especially when you live in a city where they're building new restaurants every week? Trust me, I get it. I love it as well, but our hearts may not love it. So do that sparingly. But if you stay at home and you cook your food, you know exactly what you're putting in your meals. No better feeling than knowing what's exactly in my meals and what I'm ingesting into my body. Number 4, stress management. Stress management is just as important as eating healthy and exercising when it comes to your heart health. Stress can cause certain diseases such as stress cardiomyopathy when the heart doesn't work properly because it's stressed. You want to decrease stress any way you can, whether that's meditating, whether that's through exercise, whether that's listening to music, whether that's seeking out therapy. There's so many different ways that you can decrease stress. One trick that I personally like is I love to breathe deeply with my diaphragm. So I inhale, push out through my diaphragm for 3 seconds, and then I exhale for 6 seconds. And what that does, that activates that vagus nerve, which is our rest and digest nerve, and it helps us calm down. Drum roll, please. Number 5, drinking, smoking, and straight West Coasting. We gotta get rid of that. Smoking is probably one of the worst things that you can do for your heart. It increases inflammation, it increases the ability of your heart to clot and form areas inside your heart arteries that can lead to heart attacks. Excessive alcohol. Decreasing the amount that you drink can decrease your risk of cardiomyopathy that can happen from excessive alcohol and other health outcomes. And last but not least, illicit drug use. Marijuana, heroin, cocaine, methamphetamines, all can damage your heart superbly. You want to stop those if you can. I know there's some data out there now that states that THC specifically can increase the risk of heart attacks. So even for people who may not be smoking, but maybe just ingesting THC, also a huge risk for heart disease that needs to stop. And also vaping. We want to live long, we want to prosper. We got to get rid of these vices. You made it to the end of the video. Your heart will thank you. This information is so imperative that I'm going to make this into a heart healthy series, with this being video number 1. So if you don't want to miss any of the following videos, be sure to subscribe, like, and also comment any question that you may have, and I will try my best to respond with the video. Stay tuned for more heart healthy information, and always remember, follow your heart.